control agencies, justice officials, and NHS personnel all attended the Shire Durham block, occasionally in teams of 2 or 3 above the year of several days. But the scope of abuse of human beings down there in training disabilities and autistic was not spotty. Campaigners told the authorities had unsuccessful in their jobs. The length as well turned on disgusting scenes wherever several personnel can be heard with unpleasant tongue to explain patients, time else telephone call the clinic a building of mongs. A police force inquiry has been started up and 16 personnel hanging. The Thoroughness Quality Assurance Committee, CQC, that regulates the segment, went in 3 times, in March, April, and July of recent year. One of the visits lasted 2 days and implicated a crew of 3 following concerns were grown by a whistling blower. The examination found breaches of regulation in relationship to personnel maintenance and NICE management, but the clinic stored its NICE ranking. CQC Vice Head Officer Dr. Gender Lelia told it was currently precise we skipped which was departure at. He told the controller was disappointed. He told control agencies tell to personnel and patients as so as freelance human beings known in the clinic. But no concerns were grown. The illustrates how hard it is to get by the leather of the kind of close civilization, he added. On top of the CQC trip, down there were repeated visits by 10 various councils and regional NHS bodies. Durham Justice attended the clinic 33 times above the history year, 12 since of protection concerns, in the otherwise substantially associated to the accommodation of new patients at the 17-cot block. The Justice's Enterprise CEO of Age and Public Health Facility, Jen Robinson, told, "We found no testimony offering issues of the environment shown in the program." Richard Kramer, head execution of Invalidity Mercy Feeling, criticized the attitude undertaken by authorities. He told agencies were perhaps too potential to get the buzzword of personnel at person importance, quite rather than urge on observational data and on vision the man. The appears to be a instance of professionals not putting period and asset to completely overview the thoroughness and supporting, he added. Over on Thursday, Thoroughness Secretary Caroline Dinenage said the building of House of Commons she was deep disappointed how that has happened. Ms. Dinenage told how following the by the government and the Thoroughness Quality Assurance Committee were said of the concoction of misuse at Whorlton Room, instant stairs were undertaken to provide the security of the patients down there. And she questions necessary to be requested above if the operation at Whorlton Room was penal, if the regulating and examination scope is work and as well above the input of thoroughness services. The block has now been closed and all the patients excited to some services.